For decades, health professionals under the auspices of Paho WHO and the government have worked to control the spread of malaria in the hinterland regions through primary treatment and preventative measures. The Ministry of Public Health and Paho WHO on Monday set up a National Malaria Technical Oversight Committee and discussed its functions. Dr. Kwesi Grant of the National Malaria Program talks about the committee's agenda.
You know, recently we had an influx of Venezuelan coming out, crossing our borders, seeking medical attention and seeking treatment in Whitewater Village in Region 1. And that has repercussions on us as a program in terms of medicines, in terms of diagnostic tests, and so on. So therefore, we'll just be sensitizing our stakeholders, especially regional officials, about this, so that we can become vigilant.
He said it is important that stakeholders work together to meet the needs of the public.
We know we have a lot of Brazilians here in Guyana, in the mining areas, and they too get ill with malaria. So it's very important, this collaboration. And we've been collaborating within our ministry with the Maternal and Child Health Department because also there's wind of a measles outbreak in Brazil. So we're collaborating with that department. So when they go and do their vaccination against measles with the MMR, we can also go along and do any testing as required.
Dr. Grant says the National Malaria Oversight Committee aims to build capacity at the regional level to ensure there is a monitoring and evaluation officer to carry out data analysis to respond quickly to outbreaks of vector-borne diseases and illness in the regions. Minister of Public Health, Valda Lawrence, stated that the Vector Control Unit is tasked with protecting citizens from infectious diseases.
I believe that the ongoing need for strategic approaches to put malaria on the national political agenda and to reach affected populations with specific calls to action through communication, collaboration, and mobilization is well needed now, and we ought to place it very high on the agenda if we really want to achieve our objective.
The question was asked, why another oversight committee on malaria with all that has been previously put in place to tackle malaria? This is what Minister Lawrence had to say.
The significance of such an oversight committee, of course, would be that of providing guidance and technical advice to the malaria program, especially those priority areas, and through stakeholders' participation in decision-making, process, re-policy-related issues.
Reporting for HGP Nightly News, Ayana George.